While awareness campaigns and education are available, stigma barriers continue to prevent access to treatment. Stigma is a negative stereotype that discriminates against persons with mental health and substance abuse issues. Both social and self-stigmas are significant barriers to seeking and receiving treatment. There are no boundaries to whom is affected by stigma. And although stigma is not limited to mental illness, mental health suffers the highest stigmatization. Stigma occurs at a higher rate in healthcare settings, from professionals, non-professional students, and staff. There are several manifestations of mental health stigma: inadequate access to treatment, poor treatment compliance, avoidance of services, poor therapeutic relationships, hopelessness, distrust, labeling, rejection, social exclusion, often leading to total isolation. Stigma amongst our military is complicated in its military culture. Studies have shown many military do not seek help out of fear of embarrassment, perceived weakness, fear of receiving differential treatment, perceived decrease in confidence by unit members, fear of demotion or discharge, and fear of loss of security clearance. Regardless of prevalence, growing numbers of persons needing treatment for mental illness and substance abuse disorders do not receive it. In 2016, 1 in 5 U.S. adults suffered any mental illness disorder. That is 44.7 million adults ages 18 and older. Women were amongst the highest incidence. Of these, 1 in 25 suffered a serious mental illness, equating to 10.4 million adults. However, only 19.2 million, or 43.1%, received treatment. In 2013, 20.2 million adults were diagnosed with substance abuse use disorders. 7.9 million had co-occurring mental and substance use disorders. Of those, 24% were anxiety-related disorders, 32% were mood-related disorders, 47% were schizophrenia, and 84% personality-associated disorders. 1/5 of military returning home from Afghanistan and Iraq reported PTSD symptoms. 87% of active duty and 73% of National Guard did not seek treatment within the 12 months after returning home. Of children ages 8 through 15, 13% experienced a mental health condition. However, only 50% received treatment. A staggering 17% of high school students seriously consider suicide in a given year. Serious mental illness costs the U.S. $193.2 billion in lost earnings per year. Major depression, dysthymic disorder, and bipolar disorders are the third most common cause of hospitalization for U.S. persons ages 18 to 44. The stigma associated with mental illness is more debilitating than the illness itself. Research concludes that persons with mental illness are at increased risk of chronic medical conditions. On average, this population dies 25 years earlier than others, second to treatable medical conditions. Suicide is the 10th leading cause of death. It's the third leading cause of death in ages 10 to 14, and the second leading cause of death for ages 15 to 24. More than 90% of children who die by suicide have a mental health condition. Each day, an estimated 18 to 22 veterans die by suicide. Because the highest incidence of discrimination occurs in healthcare, from healthcare students and professionals, education should start in this setting. The main perpetrators of discriminatory conduct are family, friends, and workplace staff. Lack of education and awareness is the most prominent reason for continued stigma. Interprofessional education is education shared between professionals. Student curriculums and professionals as an annual education, such as the standard precautions, could help improve collaboration, increase knowledge, and reduce stigma. Utilizing patients as educators could help reduce implicit biases, reduce self-stigma, and increase access to treatment seeking. Multi-level, multidimensional, anti-stigma education approaches can help increase awareness. Focus on learner environment, such as in the ER or surgical or student base, can help increase awareness for anti-stigma education. Utilizing face-to-face interviews with patients can promote human-centered education approaches in this multi-level, multidimensional approach and put a face on stigma.